As the SEO landscape continues to evolve, I wanted to make a video covering what we're currently doing right now and what we're seeing working to get results in behavioral health SEO. And to start, it seems like everybody's just talking about AI SEO, how everything's changing, and that's absolutely true that AI SEO is here. AI is affecting how search is happening, and it's here to stay. And what's also true is that Google is not going anywhere. The majority of the search traffic and majority of everything still runs through Google. So while SEO is changing, still the core fundamentals and principles apply. And when it comes to AI and SEO, what we're really seeing is the main difference right now is going to be the search features. As traditional search is integrating these LLMs into their searches, we're seeing a lot less traffic and a lot less clicks, especially for these more informational top of funnel keywords, because the AI overviews are answering a lot of the questions that people have before they're ever able to get to the search results. Now that's not taking away any of the demand. It's just kind of, if I were to say, it's like enhancing the user experience. When I look at AI search and I look at traditional Google Bing search, right? I look at them as kind of two different tools that are like kind of being blended together. So it's not like people are only using AI and not using Google. People are using AI for typically more hyper specific questions that they can't find on Google, but they're still using Google to find treatment centers, to research, but they're using kind of AI and it's kind of all blended together. And while there's still a lot of search volume on the AI language learning models, ChatGPT, Claude, Perplexity, still it's only compared to Google, it's about 5% of the traffic currently right now is through LLMs. That means that 95% of search traffic is still happening on Google. Now, a lot of that is getting eaten up by AI overviews, but still, nonetheless, Google is still king in the world of SEO. And I'm seeing a lot of people come in and really try to cement themselves as these kind of authorities on AI search, and they really hype up AI search to where it's like the new hot thing. And I really just think there's a little bit too much hype around this because like AI SEO, regular SEO is kind of very, very similar, like maybe some subtle differences. Maybe 80% of AI SEO is just regular SEO. And so these kind of gurus and people on LinkedIn talking about how they have these new AI strategies, I just don't think that it's worth all of the hype that it's getting. While it is still valuable, it's not this like crazy, never seen before tactics that you're using to rank for AI SEO. If anything, what AI is doing is it's kind of making the workflow more efficient to actually publish more SEO content. And as a result, we're seeing a lot of these, at least on my LinkedIn feed, I'm seeing a lot of SEO gurus who are coming in and they have this get traffic quick schemes. And I see, their traffic charts are just going up. Like they'll get tons of traffic within like a month. And they're really, in a sense, like they have this new, never seen before strategy. And what happens is, yes, these kind of short term tactics might work temporarily, but then you check the same website 4 months later and the traffic just falls off a cliff. And so I'm noticing a lot more kind of spam content, kind of short term strategies that are circulating with this new AI workflows that are coming in. And you can just publish a ton of content super quickly. And yes, some of the short term tactics work, but really, like short term SEO, gray hat, spam tactics have always been there. And eventually Google is going to catch up. It's in Google, Claude, Chat's best interest to make sure that these spam strategies really don't like cement themselves as like actual SEO. So I would be careful whenever you see somebody on LinkedIn talking about this new strategy that's probably has to do a lot with spam content, really making fast pushes to get traffic quick. If it's get traffic quick, it just typically never lasts. And if anything, we're still really focused on the fundamentals of SEO. What worked before is still working now, even with all the hype and all the craze that's going on. Like we're still focusing on those fundamentals. And if anything, we're being very particular on what content to post. We don't want to just post a page or index a page for no reason. We want to make sure it serves an actual purpose because the content now is so commoditized since there's so much spam getting out there. There's so much copies of pages that are already ranking that you're not going to rank in a competitive city. Let's say you're in a competitive city and you're trying to rank for, alcohol treatment near me. You're not going to rank if you just make the same exact content as what's already ranking. It's just a commodity. There's so many people already doing that. And so when we are looking on what type of content we want to make, it needs to serve a purpose. It needs to be a page that we have not made before. And we want to have some sort of unique angle, unique authority, perspective, data that we can add in that the other pages don't have, because that's really what Google wants. Is they want content that serves a specific purpose. They want better, high quality content. And as far as like choosing what pages to make or what kind of keywords to focus on, really we want to look at what's already working. What topics are we already ranking high for? And those are the topics we want to really build around. For example, let's say your treatment center is ranking really well for opioids, then we probably want to make as much content we probably want to exhaust the whole ecosystem of opioids first and really get deep before we move on to another kind of drug that we would want to be ranking for. And even then, let's say we exhaust opioids, then we'll probably want to then transition into another topic that is somewhat related, like prescription drugs, because it's already kind of similar. And so really just doubling down on what's working and kind of not going after every topic under the sun, but focusing on what you're already winning at, basically. And then being aggressive. Like if you're looking and each page doesn't have a specific purpose that it's serving, then we're getting rid of that page. We want each page to be unique and valuable, because Google is not valuing who has the most pages. They're valuing who covers the topic the best and who does it the most efficiently. It's way, way more important. And that's super important, especially for these competitive cities, these competitive keywords. And when we're picking competitive keywords to go for, we're also very, very intentional, because there's just such a difference, especially when it comes to search intent. Let's say we're trying to find a competitive keyword that's going to take 6 months. It's going to take 8 months to rank for, right? We want to make sure we're picking the right keyword to build off of. And that's making sure that the keyword we have, there could be two similar keywords with high intent and high competition, but the intent of the user is different, what they're actually hoping to get out of the search. For example, let's say someone searches up drug rehab in Sacramento, right? That's a great keyword to rank for, right? But if you look at the actual intent, what are those people looking for? Some of them are definitely looking to get treatment right now, but some of them might just be kind of casually like researching what drug rehab looks like, versus another very competitive keyword, which might be inpatient drug rehab in Sacramento. Yes, that keyword might still be competitive, but it's probably going to have a lot less searches than drug rehab in Sacramento. But if you think about the intent, if someone's typing in inpatient drug rehab, they already are educated enough to know what inpatient is. They're probably a lot more serious and high intent. So if we're going to spend 8 months to rank for a high intent keyword, we're probably going to want to do it for a keyword that matches the intent that we're going for, which is typically, if you go, the deeper you go, right? We have drug rehab, right? If you go inpatient drug rehab, that's one level deeper. Those are typically going to be keywords that we like to focus on more, because the intent's just better. And really, once you've kind of identified a keyword that you really want to attack, then you're not just going to rank immediately for that keyword. It's kind of like you have to attack the sub keyword. So let's say there's like 10, there's one big keyword, and within that one big keyword, there's like 10 sub keywords, right? If you want to rank for that one big keyword, you're going to have to kind of start from the bottom of the totem pole, is like beat level 1, rank for one of the sub keywords. Then you want to beat level 2. And once you kind of ranked for all the sub keywords, that's when you can start competing for those big keywords. But you kind of have to work your way from the bottom, complete chapters 1 through 9 first before you can get to chapter 10. That's kind of how it works, just starting from the bottom. But you're being very strategic though about like what keywords you want to go for. And because it's going to take time regardless of what keyword you go for, so you need to make sure you're picking the right ones. And nowadays with this so much commodity content out there, like how do we actually gain trust with the algorithms and the visitors? Because if there's one thing that Google has, is its data. Like Google knows if your website is good or not based on so many different metrics. And one of those metrics is definitely going to be, how are people behaving on your site? What's going on? How long are they staying on the site? What are they doing after they visit your site? And if they look at the metrics and your site, people are bouncing off there really quickly and they are not staying, then that's a really bad sign as far as the UX metrics go. And so we want to make sure that our site design's clean, that the copy isn't just built strictly for the search and the Google search and AI search. We want to make sure that it also satisfies the visitor, that they're staying on your website, because trust me, Google knows. And if they see your UX metrics are bad, they're gonna downrank you, especially nowadays when everything's just so commoditized. And really, like, how do we stand out in a field of just so much commodity content? in such competitive spaces is building trust. And one of the biggest ways we found to build trust with both the search engines and the visitors is authority. Who's actually writing these articles, right? If we can, like, can we have a clinician? Can we have a psychiatrist? Can we have someone on your medical staff actually read through, review one of these articles so we can add them to the article and have more authority on these articles? Because Google cares who's writing it, the people care who's writing it, they care how is it getting medically reviewed, especially in the healthcare space. Google really cares about who's writing it, and so do people. And so if you can, like, getting someone on your team that's qualified to review these articles and contribute is really like how we can just start to separate ourselves from all the commoditized junk that's kind of going on. Not junk, but the commoditized content. And so one of the biggest mistakes we're seeing as far as what our clients are doing before they get to us, what competitors are doing in the behavioral health space, is really just kind of the blue ocean strategy of just going after every keyword under the sun, trying to rank for everything at once, and making content that cannibalizes itself. And really, in this day, quality is going to be more important than ever. And so making sure if it's not good, if it doesn't serve a purpose, let's get rid of it, and let's not try to go for every topic under the sun. Let's focus on, what are we already winning at? What do we already have topical authority at? Because we're even seeing like really established sites that have been getting traffic for years starting to lose traffic because they are kind of taking this blue ocean approach. And if you have a smaller, maybe medium-sized, small treatment center come in and really attack a topic, really create some good content around a specific drug, a specific mental health condition, right? And they really cover it better than the established website. We're seeing some of the traffic is getting lost to these smaller, medium-sized treatment centers that are really focusing on quality. They're pruning the pages. They're not just getting out as much as possible. So really, in today's age where volume is commoditized, it's about quality, being very strategic and intentional on what we do for SEO, and the basics are still working. And yeah, if you guys have any questions, feel free to reach out at admita.io, and I hope you enjoyed today's episode.